Hi, my name's Ian Wright, and I've been asked to do a podcast around ASD, Autistic Spectrum Disorder, or group of disorders, for ASD Day, which is coming up in the next few days. I've spent about 25 years now working with children with a variety of autistic disorders, from the high-functioning disorders and Asperger's syndrome to quite severe autistic disorders. ASD affects primarily communication, language, social connection, reciprocal interaction. There are also stereotype behaviours, repetitive behaviours, lack of eye contact, and lack of connection, social connection. That's the real key areas. In autistic spectrum disorder, it's diagnosed by a test called DSM-5, which is a kind of clinical test which gives you certain categories which have to be passed through, for example, eye contact, language communication, speech and language, and other social interaction issues. And if you pass through a certain amount of hoops, you get this diagnosis of autistic spectrum disorders. Why does this happen, and why is it so prevalent? I mean, I think personally the prevalence of it has gone up in the last 10 years. That's debated because the diagnosis has become a lot clearer, and there are lots of pre-screening at young ages, from sort of 18 months, 2 years old, where children get fed into systems where they'll get diagnosed quite early on. I still think personally that there is a higher incidence of it, as well as a higher diagnosis of it. What causes it? It's unknown, and there's an awful lot of research out there around it. I have my own personal views, which I'll talk about in a minute, but there is, I think, and the research shows that there is some specific genetics, predispositions, certain single gene mutations which affect some of the proteins and affect some of the methylation processes, which is part of the kind of metabolism, the way the cells function, and certain epigenetic issues, which are some of the sort of conditions around the genes functioning, which is a big new area of work, which I think will yield a lot more interesting features as time goes on. There are certain specific issues that can trigger autism. For example, having rubella in pregnancy. There are certain tendencies to maternal preterm infections that can trigger it. There was some thinking that thimerosal, which is a mercury base in certain vaccines, which aren't actually used much anymore, but more recent studies have refuted that. Hard to know. So there's a wide variety of potential issues that could be having some sort of triggering effect in autistic. The actual changes that happen, which there's an increasing amount of studies using PET scans and functional imaging, and there are certain particular areas of the brain that can get affected. For example, the way the frontal lobes of the brain connect with other areas. There's certain areas of the prefrontal cortex, and the way the frontal lobe connects with the parietal lobe, and areas of the limbic system, the medial temporal lobe, the amygdala, for example. There's in certain situations, there's been functional changes in the cerebellum. It's either the cerebellum's too big or it's too small. Other studies have shown that there is an increased white matter growth. The white matter is the supporting cells. It's like the insulation of the grey matter brain, and the white matter tends to overgrow. I see that personally as a reaction to whatever's going on. It's the body trying to sort of sort itself out. So the interesting thing, looking through all these studies, I've been teaching around ASD for about 20 years now, is that the studies are inconsistent. the areas of the brain affected are fairly inconsistent. There's no particular story, and it changes a lot. So that's why people are not sure. There's other potential areas that are involved, like, for example, serotonin pathways, which is a part of the brain chemistry, which is important in the development of growth and cognition. And there is some evidence to show that these serotonin pathways are disrupted to some degree, and there's some research that says that there is elevated serotonin with children and their families of ASD, and that's also linked with obsessive compulsive disorders and depressive disorders. It's interesting that males tend to show autistic spectrum symptomology 3 to 4 times as much as females, and it affects now as much as 1 in 88 children, I think, globally. So it's not huge, but it's there, and of course in practice we see a lot of these children. There has been studies, actually. There's a study that came out quite recently in Sweden where they looked at about over 300,000 mother-baby relationships, and they found that there was a 31% lower risk of ASD when mothers took multivitamins in pregnancy. And this was not related to folic acid, whether they took it or not. That wasn't part of it. It was just the multivitamin situation, and the iron was not related to it either. Other research has shown that when they were doing research of the teeth in baby teeth in twins, where they could tell if one, they had very similar environments and very similar intrauterine environments, that in ASD there was a greater uptake within the teeth of lead, but there was decreased, and lead is a neurotoxin, affects the brain, as mercury is, and there was a decrease take-up of manganese and zinc by the body. So there's this disruption that happens as well. And the question is this a cause or is this effect? For me, ASD functions like an autoimmune disorder, as in the body's immune system is overreacting and it's affecting the development and the developmental function of the brain, the neurology. So something has triggered the immune system of the body to have this, for me, this reaction, and who knows what it could be, a whole plethora of things, and which can affect genes and epigenetics, or it could be because of genetics. There are some families that are prone to Asperger type high functioning disorder, high functioning autistic disorders, but in years gone by, those children and adults, and they say, oh, well, my dad was a bit like that. They were, they had poor social conditioning, but certainly had areas that they would like. For example, they were great train spotters or plane spotters, but they didn't really like to communicate with people. And those children and adults can be seen these days, could be diagnosed as having Asperger's or high functioning autistic difficulties. Now that may not be any there may not be any functional brain dysfunction here, but what we're talking about, I suppose, more is in autistic spectrum where it's a problem, where there's no eye contact, there's no verbalism, they're distressed and they have sleep disorders often, and actually about a third of autistic spectrum children have seizure disorders, which is very unpleasant for them. Coming back to this kind of autoimmune, there is certain studies, and from my personal experience, there is certain connections between gut disorders, a gut dysfunction, gut dysbiosis in ASD. So they often have problems with their digestive process, and I think that is that the cause of it? I'm not sure, but can it affect it, and is it part of the same disorder? Possibly so. Hard to know, but certainly from my personal experience, if you do certain things, it can actually help with children, and it can strongly sometimes really bring on their eye contact, etc., etc. For example, casein, which is in dairy produce, and gluten If you remove dairy and gluten products, you can get, in some cases, not certainly, unfortunately, not in all cases, you can get some improvements. For example, other children who, if you put on bone broths that have strong mineral, or you give them content, or you give them a very good probiotic, it can be helpful as well. So in all the children we see, we tend to certainly screen them for gluten and casein intolerances, and hopefully put them on a good probiotic that's suitable to them, and suggest certain dietary changes. What we do, I'm an osteopath, and what we do as osteopaths is actually try and free up where there's blocks. And so we're looking at the fluid dynamic, which is around the nervous system, the meninges that can be very tight in these situations. We can look at the function of the gut and helping that in as best way we can. And what we're interested in is motion, and and there's particular areas of dysfunction and blocks that you can feel in their nervous systems, which we try and help with as much as we can. And I treat autistic spectrum disorder children, probably 10 or so children every week at least. And in our Daisy clinic, we treat a lot of children, and with varying results. Sometimes it can be helpful in terms of distress. Some children you treat and they really clearly move on with eye contact and connection. Some are harder, but overall we seem to, the parents certainly report positive changes, and so it makes it worthwhile. But there's certainly no easy cure to, unfortunately, that I've ever come across with ASD, and I think that it has to be tackled in a multitude of ways, in terms of diet, in terms of occupational therapy, in terms of some sort of osteopathic support as well, especially nutritional support. All these kind of things have to come together, and actually most importantly is actually the needs of the child, that they're met at school and that they're getting the right support to help them feel less distress, because sometimes it can be hard to be to be around other children, because it becomes a pressure for these children. So I think as with all of these complex disorders nowadays, we need a team of people working together to support their function and maximize their function. And as far as I'm concerned, anything that is helpful is good. It's a very interesting subject, and I will continue to research it. Happy ASD Day anyway.